Question number 1. Which of the following is the primary level of prevention? Correct option is B. Health education. Question number 2. Which level of prevention is involved in screening for hypertension? Right option is B. Secondary. Question number 3. The best method to prevent communicable disease is. Right option is D. Immunization. Question number 4. Which method best promotes health in a community? Right option is C. Community participation. Question number 5. Which nutrient is essential for prevention of neural tube defects in pregnancy? Correct option is C. Folic acid. Question number 6. Which of the following is an example of lifestyle disease? Correct option is A. Diabetes. Question number 7. Under the national program, vitamin A is first given at. Right option is B. 6 months. Question number 8. Common cause of anemia in pregnancy is deficiency of. Correct option is C. Iron. Question number 9. The role of a nurse in health promotion includes all except. Right option is C. Disease diagnosis. Question number 10. How often should a tetanus booster be given to adults? Right answer is B. Every 10 years. Question number 11. Health for all was the slogan of WHO for the year. Right option is D. 2000. Question number 12. Which condition is a contraindication for beta blockers? Right option is C. Asthma. Question number 13. Which position promotes lung expansion in dyspneic patients? Right answer is B. High Fowlers. Question number 14. Which organ regulates erythropoietin production? Correct option is B. Kidney. Question number 15. Which blood cell is increased during bacterial infection? Right option is C. Neutrophils. Question number 16. Which of the following organ is affected by nephrotic syndrome? Right option is A. Kidney. Question number 17. Which symptom is commonly seen in left-sided heart failure? Right option is C. Dyspnea. Question number 18. Which food should be avoided in renal failure? Right option is A. Banana. Question number 19. What is the safest method to confirm an esophageal tube placement? Right option is C. X-ray. Question number 20. During a disaster, the triage color for life-threatening but treatable condition is. Correct option is B, red. Question number 21. Who is responsible for maintaining a safe environment in a hospital? Right option is B, all healthcare staff. Question number 22. Which of the following breaks the chain of infection? Right option is C, hand washing. Question number 23. Before applying soft restraints, the nurse should be checked. Right option is A, skin integrity. Question number 24. Which defense mechanism involves returning to an earlier behavior? Right option is B, regression. Question number 25. Which vital sign should the nurse check first after giving morphine? Right option is B, respiratory rate. Question number 26. A patient with heart failure gains 2 kg in 2 days. What does this indicate? Correct option is C, fluid retention. Question number 27. Which vaccine is given to newborns before discharge? Correct option is C, hepatitis B. Question number 28. What should the nurse monitor when giving a diuretic? Correct option is B, potassium levels. Question number 29. Which electrolyte is most affected in renal failure? Correct answer is D, potassium. Question number 30. Which of the following is a common side effect of albuterol? Right option is B, tachycardia. Question number 31. What should be done first when a client reports chest pain? Right answer is C, administer oxygen. Question number 32. Which symptom is expected in Parkinson's disease? Right option is B, tremors. Question number 33. Which is a common side effect of amoxicillin? Right option is A, rash. Question number 34. What is a common sign of dehydration in children? Correct option is C, sunken eyes. Question number 35. What should the nurse assess first after giving blood transfusion? Correct option is A, vital signs. Question number 36. What position is best for a client receiving tube feeding via NG tube? Right option is C, semi-Fowler's. Question number 37. How long should a nurse scrub hands during hand washing? Right option is B, 20 seconds. Question number 38. Which supplement prevents neural tube defects? Right option is D, folic acid. Question number 39. Which precaution is used for a client with C, difficile infection? Right option is D, contact. Question number 40. What is the best method to prevent spread of infection? Right option is C. Hand hygiene. Question number 41. A confused client keeps getting out of bed. What should the nurse do first? Right option is A. Use a bed alarm. Question number 42. At what age should a child receive the first dose of MMR vaccine? Right option is B. 12 months. Question number 43. At what age should blood pressure screening begin in children? Right option is B. 3 years. Question number 44. Which assessment is best to check for dehydration? Right option is A. Skin turgor. Question number 45. Which position is best for a patient having difficulty breathing? Correct option is C. Fowler's. Question number 46. Which organ is primarily responsible for insulin production? Right option is B. Pancreas. Question number 47. What is the correct angle for giving an intramuscular injection? Correct option is C. 90 degrees. Question number 48. What is the name of the process by which white blood cells engulf pathogens? Right option is A. Phagocytosis.